I'm Katie. I'm the lead physical therapist here at Center for Sports Medicine. It kind of started as just intermittent hip pain, and it would get worse when I would work out, after being on my feet all day long, up and down off stools, that sort of thing. And then it gradually worsened over about a year and a half, and started interrupting my sleep at night. I chose Dr. Miller because I had treated several of his patients that had had the labral repairs done. A lot of them were a little bit older than I am, some of them were a little bit younger, and they all had really good outcomes.
So I do sports medicine, mostly hip, knee, and shoulder arthroscopy. And hip arthroscopy is a little bit of a newer procedure within the last 10-15 years in orthopedics. Over time, she had developed this soft tissue tear called a labral tear, which is the lining around the hip joint. You do all the procedure with little incisions, use a camera in one incision and use instruments in the other, so it's not a big open approach.
Within just a couple of weeks, I was off the crutches. I was able to sleep at night, which was a huge thing. And that was my biggest complaint, was not being able to sleep at night, because you just can't function the rest of the day. And so within about 6-7 weeks, I started to just be able to do more, to walk across the room without pain. I came back to work at 5 weeks out, started seeing patients again, and just, it was completely different than before I had the surgery. And so I'm 5 months out now. I'm back to working out. I can sit on the floor again and play with my kids.
People come in and they are wanting to get back to an active lifestyle, and so that's everybody's number one goal, and that's our number one goal, is to try to get people back doing what they want to do and doing what they enjoy.
Dr. Miller is just one of those people, he's easy to talk to, and he, as far as being on the physical therapy side of things, he trusts us, and he's good about listening to what we're saying, and I think that means a lot for patients too.